Good morning. Today we have the lecture of hypertension by Dr. Amr Gawaly, Assistant Professor of the Internal Medicine. First of all, what is the definition of systemic hypertension? And the word systemic means that it can affect many organs in the body. The definition of the systemic hypertension is persistent elevation of the blood pressure more than 140 over 90 millimeter Hg is diagnosed as hypertension. Very important in the definition, the word is persistent. It means that not single measurement is diagnostic for hypertension. You must measure at least two measure and the difference in between, the time in between is about 1 week. They are classified the hypertension into many categories, three categories: normal, high normal, and hypertension. And the hypertension is classified to three stages: stage 1, stage 2, and stage 3. Why we are classified uh, uh, these categories? Because in the treatment and the complication will differ from stage to other. Normally, the systolic blood pressure is less than 130 millimeter Hg and the diastolic blood pressure is less than 85 millimeter Hg. But from 130 to 139 in the systole and 85 to 89 in the diastole, this is called high normal or pre-hypertension. High normal or pre-hypertension. The pre-hypertension is the stage where we make many measures for control of the disease. This measurement is uh, lifestyle modification, like to avoid the stress, avoid smoking, try to decrease the body weight. If the cholesterol and triglycerides is high, we taking a medication for this, and so on. Hypertension stage 1 is mild, from 140 to 159 in the systole, and diastole is from 90 to 99. Stage 2 is the moderate hypertension. It is from 160 to 179 in the systole, and in the diastole it is 100 to 109. Stage 3, the severe hypertension, is more than 180, and in the diastole is more than 110. We are differentiated the hypertension to two types: essential hypertension and secondary hypertension. What's mean by essential hypertension? Essential hypertension is with no obvious cause. Usually this is occur between the ages 35 to 55 with positive family history without any apparent cause. Diastolic blood pressure usually more than 90 millimeter Hg, and this is usually associated with elevated systolic blood pressure. When the diastole is increased, the systole is increased because the diastole is related to what's called peripheral resistance, meaning that the peripheral arteries and the capillaries have a decrease in the size and they become narrowing, so the resistance inside it elevated, so it will elevate the systole. Automatically, when the systole is elevate the diastole, sorry. Automatically, when the diastole is elevated, the systole will be elevated. What is the theory of the primary hypertension? Theory means that it is based, it is evidence, evidence as regard the science, but we cannot approve it. The first theory is renal theory. There is increase in the renin secretion. What is the renin? Renin is a substance secreted from the kidney when the blood pressure is decreased, so the kidney blood flow is decreased, feeling that the blood pressure is low. Start to secrete the renin, which will transform it to aldosterone, which making salt and water retention and elevate the blood pressure. So, if the kidney itself elevate the renin secretion, it will lead to automatically to hypertension. Increase adrenal gland, as all you know that the adrenal gland secrete adrenaline and noradrenaline, and this is substance making a vasoconstriction of the blood pressure and uh, uh, elevate the blood pressure. Increase activity of the sympathetic discharge. The sympathetic stimulation leading to vasoconstriction of the blood vessels and also will lead to hypertension. Genetic factor like obesity, like family history of hypertension and so on, and obesity itself it leading to hypertension. The secondary hypertension usually in the age less than 35 or more than 55 years, and family history is usually negative. The causes of the secondary hypertension is any diseases occur in the kidney, some diseases in the endocrine, pregnancy, and the drug. Renal, for example, glomerulonephritis. This is the inflammation of the glomeruli, the functional unit of the kidney. Diabetic nephropathy, inflammation of the nerve in the diabetic patient. Renal artery stenosis. You know that the renal artery is the artery which supply the kidney by the blood. When there is a stenosis, the kidney will feel that the blood pressure is low and start to secrete renin, so it will elevate the blood pressure. Polycystic kidney disease, and it's a congenital disease making the kidney like a cyst. Endocrinal Cushing syndrome. This is a disease in which the corticosteroid secretions is increased and it lead to elevated elevation of the blood pressure. Hyperparathyroidism. This is another endocrinal cause of secondary hypertension. In the pregnancy, preeclampsia mean that uh, uh, the elevation of the blood pressure related related to the pregnancy, and this occur usually in the third trimester, and it is a fatal condition. The patient must be we are going to termination of the pregnancy because it may lead to fits and may lead to death of the mother if you not control this problem. Drugs like corticosteroid and oral contraceptive pills, and you must ask the patient about the oral contraceptive pill by itself, because sometimes the patient not mention any drugs related to the contraception. Clinical picture and the complication of the hypertension. Mostly the patient with hypertension is asymptomatic or sometimes coming by just headache. But it will discovered accidentally or discovered after the complication it occurred. Types of headache is occipital headache, taking the front of the head, and sometimes we having a blurring of vision. It is haziness in the vision of the patient, making them cannot be concentrate for any image in front of him. What is the complication? Complication is target organ damage. We are calling the hypertension is the silent killer because it can damage any organs in the body. When the target organ is damaged, the complication is reached, and when the complication is occur, it is so difficult to correct after. For example, in the heart, the hypertension leading to ischemic heart disease. Why it lead to ischemic heart disease? Because when the hypertension is the blood pressure is increased, the size of the muscle will be increased, making what's called LVH, left ventricular hypertrophy. And this left ventricular hypertrophy, left ventricular hypertrophy, and this left ventricular hypertrophy may increase the size of the muscle, although the blood supply from the coronary to this muscle is the same. So it is relatively decreased because the size of the muscle is increased and the amount of the blood is fixed, so the total blood going to the muscle will decrease. Atrial fibrillation leads arrhythmia or changes in uh, in the blood, changes in the rhythm, leading to tachycardia, and this is one of the serious complications, may be fatal later on of the heart. Neurological, the patient will suffer from stroke, cerebral hemorrhage, and lacunar infarction. Cerebral hemorrhage means that bleeding occurred due to the pressure is high. But what is the lacunar infarction? Lacunar infarction is a small thrombi occur in the brain because we have in the brain what's called the blood-brain barrier, and this blood-brain barrier prevents the gush of the blood inside the brain. And so if the blood pressure is persistently elevated for a long time, the blood-brain barrier making vaso constriction to decrease the blood flow to the brain to prevent the bleeding or thrombosis. This is making a problem that it will lead to microthrombi, and these microthrombi, when starting to the liquefaction or necrosis of this thrombi, it take the shape of lacunar or the half of moon. This is the shape of this thrombi. Because this thrombi is small and taking small parts of the brain, usually this patient suffering from mood disturbance, sometimes the problems in the memory and so on, not have a major complaint from this problem. Hypertensive encephalopathy means that the gush of the blood is going to the brain, so the pressure inside the blood vessels of the brain is increased, leading to escape some of water in the brain itself, leading to what's called the brain edema. And this brain edema will lead to encephalopathy or disturbance in the consciousness. And this is an emergency medical condition. This patient must be admitted to the ICU and taking dehydrating measurement and physics till the blood pressure is decreased. Kidney, the persistent hypertension will lead to renal failure. Also in the eye, it will lead to retinopathy. Sometimes it may leading to bleeding in the eye, leading to what's called optic disc edema, and so on. And this is a problem related to increase the pressure inside the blood vessels. Side effect of the antihypertensive drug itself. Investigation. We need investigation to diagnose the patient that is hypertension. Actually, no. But the investigation we are doing to know if there is any risk factors of or cause making the hypertension. And the second item is to evaluate if the patient is reached to the stage of complication or not. ECG and X-ray, we will have left ventricular hypertrophy, long-standing left ventricular hypertrophy in the long-standing hypertension, and this is what's called that the size of the muscle is increased due to the persistent high pressure. Echocardiography, we will found that in the echo, the left ventricular hypertrophy also, and it is one of the most diagnostic investigation for LVH. Fundus examination, if it's positive, this indicates long-standing hypertension. We will be found hemorrhage or exudate mean that scaving of the fluids and increase the pressure, making edema in the optic disc or in the fundus. Investigation for the cause, and this we are doing for secondary hypertension. This is we're doing for secondary hypertension. Urine analysis for protein. First problem, okay, if the kidney is affected or have any disease in the kidney, is proteinuria. Kidney function test, urea and create. Cortisol level, if we suspect this patient having a Cushing syndrome. Lipid profile, triglyceride and cholesterol. This is one of major important risk factor for hypertension. Treatment. First of all, we need lifestyle modification. The lifestyle modification we need to avoid stressful condition and avoid straining, because all of this will lead to sympathetic overstimulation and will lead to vasoconstriction of the blood vessels. Diet, we must having a salt restriction, excessive fruit and vegetables. The lifestyle modification and diet control is sufficient in the pre-hypertension patient, but in the diseased patient, we must doing this and taking also medication. Salt restriction, excessive and taking excessive fruits and vegetables, low fatty diet to decrease the cholesterol, low carbohydrate diets to decrease the body weight and limit the obesity. Weight reduction, the BMI must be less than 25. What are the drugs used for the treatment of hypertension? First group is diuretics, and as all you know that diuretics is drug that making increase the urine flow, so it will reduction of the blood and extracellular fluid. Groups of the drugs of diuretics is many drugs like thiazide. Thiazide is diuresis and vasodilatation, so it making double action in the hypertension. The most common one is hydrochlorothiazide, but we don't have in Egypt hydrochlorothiazide by itself. It will be added to other drug. For example, we have drug called capotin. This is captopril, and the capozide. This is captopril plus hydrochlorothiazide. The next drug is indapamide or natriexate ester. The indapamide or natriexate ester is the only drug as a diuretic used in the treatment of the hypertension. Usually, diuretic is an emergency drug for severe hypertension, but we don't use for long time. Except the only drugs that can be used for long time and found that have an efficient effect for the control of the hypertension is the indapamide or natriexate ester. Furosemide or Lasix not routinely used, just only in the emergency and if the patient having a lower limb edema. Spironolactone or aldactone is a potassium sparing diuretic, and it's one of the important diuretics, can control also lower limb edema and blood pressure. The next group is the beta blocker. As all you know that the sympathetic innervation have an alpha and beta receptors. Beta blocker, uh, the uh, the beta receptors. Value, it is negative in trope, so it may lead to vasodilatation. We have two groups, non-selective and selective. Non-selective means that it functioning in the receptors present in the heart and other sites in the body, for example the lung. Uh, 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 the name of this drug is Indrol and Carvedilol. Selective, it's just working in the receptor in the heart. There's atenolol, like drug called tenormin. Bisoprol, drug called Concor. Indrol or Carvedilol, it is a non-selective. All of you will know that the non-selective, it is not preferred, but we are used in specific situation. For example, if the patient have a thyroid toxicosis and hypertension, Indrol is the best drug because it have a function in the reduction of the thyroid hormones. And so on. If the patient is hepatic and have a portal hypertension, we are preferred Indrol because the Indrol is decrease the portal hypertension and also decrease the hypertension. So we are saving non-selective drugs for special situations to other diseases that the patient has a hypertension and have another problem. Alpha blocker is working on the alpha receptors, making arterial vasodilatation and venodilatation. The important drug is prazosin or miniprest, doxazosine or cardior. Centrally acting drug that it work in on ganglia or brain, mainly alpha methyl dopa or aldomet, and mainly used in the pregnancy and the chronic renal failure, because these drugs not go to the placenta barrier in the mother, so it will not go to the fetus, not transmit the placenta barrier. Calcium channel blocker, as all you know that the actin and the myosin having calcium channel making contraction and relaxation. So when we are closed the calcium channel, the muscles of the blood vessels will be relaxed and making vasodilation. Important drug for this is nifedipine or Epilat and amlodipine or Alka-Pres. Nitrates they can used by infusion in case of hypertensive encephalopathy, and it is an emergency drug called glyceryl trinitrate or tridil. It is used in the ICU when the patient is admitted. We are taking by infusion drops till the blood pressure is controlled. As you know, in the emergency condition, it's so difficult to start by oral drug. We must taking IV drug to control the blood pressure rapidly. The next group is the angiotensin converting enzyme inhibitor. We are seeing the renin system. The renin will transfer the aldosterone. It will transform it to aldosterone by this enzyme called angiotensin convertase enzyme. So when we are inhibit this enzyme, the renin will not transfer to aldosterone, so the hypertension will not occur. Decrease the aldosterone synthesis, so decrease the blood pressure, used in the hypertension, heart failure, diabetic nephropathy. Why in the diabetic nephropathy? Because we are found that this is the group of the drug making also reduction of the proteinuria in the patient with diabetes. And then heart failure, we have a very important role for this drug. It will decrease LVH or left ventricular hypertrophy. Side effect for this drug is dry cough, and when it occurs, we must shifting to another group. For example, of these drugs, captopril or cabotin, ramipril or tritase, enalapril or izapril. The last group is the angiotensin 2 receptor antagonist. It is the same functional like the ACE or angiotensin convertase enzyme inhibitor, but it targets the receptor itself, which fighting for the receptor of angiotensin 2. Angiotensin 2, this is the last product will transform it to aldosterone. So the angiotensin will not transform to aldosterone. The same action of ACE inhibitor, but they don't cause cough. So when the patient is suffering from dry cough, we can shifting to this group. They are used for patients who cannot tolerate an ACE inhibitor. They include losartan or Cozar and valsartan or Tar. Sometimes we are needing to use adjuvant drug therapy of hypertension, antiplatelet like aspirin to reduce the cardiovascular risk, and lipid lowering drug to control this problem called this group of drugs called statin. Antiplatelet to prevent thrombosis, and statin to lowering the cholesterol and triglyceride, because these lipids will be precipitated in the wall of the artery and making the artery to be narrow and increase the blood pressure. Now the question, which one of this group we can use for the patient? We have many regimens to use the drugs of hypertension, but we are choose for you one of the simplest regimen. It is called A or B plus C or D. What this mean? A is the ACE inhibitor, B is the beta blocker. ACE is the ACE inhibitor or angiotensin convertase enzyme ACE inhibitor, or ARBs, angiotensin receptor antagonist. B beta blocker, C calcium channel blocker, D is the diuretic. How we use the drug? If the patient is naive hypertension, have no other disease, you can use A or B or C or D, any drug. But the diuretic, the only drug we use in hypertension is Natrilex SR or Endopamide. Okay. So if you are using ACE inhibitor and the patient is controlled, well and good. Patient not controlled, use calcium channel blocker or diuretic, not beta blocker. يعني so we are taking one drug from the first group and one drug from the second group. If the patient taking ACE inhibitor and, for example, diuretic and not controlled, you can taking another drug from any both group. You are taking ACE plus beta blocker plus diuretic. If the patient is not controlled, we are taking ACE plus beta blocker plus calcium channel blocker. Sometimes we are reaching to 5 or 6 drugs to control the hypertension of the patient. The rules for the using of the antihypertensive drug start with low dose S inhibitor, 12.5 milligram every 12 hour captopril, or calcium channel blocker 25 milligram at unit per day. If no response, double the dose. If no response, added low dose thiazide. So we are taking another drug from the second group, 12.5 milligram to 20 milligram per day. If no response, give full dose of the initial drug plus thiazide. If the patient is not response, we can add alpha methyl dopa alpha blocker till reach to the control of the blood pressure. So we are increased gradually and using the drugs according to the response of the patient. Thank you for you.